solving musculoskeletal problems. Welcome, Hala.
Thank you, Ashna. I think the title reflects all of our talks, I believe. Thanks, David Hunter, for doing this with us. And so I'm presenting on behalf of the ARC Training Center. You will see the different projects happening in the center. These two, the nanoparticles for theranostic and the organized 3D printing, are new project added after we were granted the center. And you will hear from the medical imaging and electroceutical team. And I have the pleasure presenting all my people here to talk about the biomaterials and the nanoparticles and the organoid 3D printing. Our work involves looking at strategies to regenerate musculoskeletal tissues. This encompasses the development, design, and manufacturing of synthetic materials that can resemble the tissue that we want to regenerate. These are the different projects happening in the lab now, and synthetic ceramics for regeneration of large bone defect under load, tendon and ligament material, injectables, bioactive bone cements. Recently, we looked at the ability of our materials, the ceramic that we developed, in turning senescent cells into young cells, and I will touch base on that. Hot of the pressed work on the 3D printing microtissues and organoid systems, and on the multitasking nanoparticles for theranostic, which I will talk about as well. And it's a pleasure to work with our partners from Swinburne University, who are experts in plasma spraying of orthopedic implants with the ceramics that we have developed, and currently working together with Allegra. They're modifying the knee implants with our ceramics. The first project I'm going to talk about is the Holy Grail of synthetic material. I'd like to call it the Holy Grail because I believe it will, it has shown us that this material is mechanically strong at high porosity and interconnectivity. At times it can become tough. So this is a pure ceramic for regeneration of large bone defect under load. We have shown that this material is highly bioactive. We haven't confirmed the resorbability yet, but I'll show you evidence of some of that. And the antimicrobial properties is the subject of the work with Khan at RMIT, who presented just before me. So over the years, we've developed a number of ceramic materials for bone regeneration. And what I'll talk about, some of the work here, these two are now with Allegra Orthopedic, an Australian orthopedic company. And these are most recent materials that we have developed and patented. We use 3D printing to develop the material or to manufacture the materials simply because we are interested in translating them to the clinic. So we need a reproducible method to print these materials. This is just a ceramic, and it's not easy to get to this point. And that's only because we have the beautiful people we have. This work with Iman Rouhani. So we printed this material, and then we implanted it, and we validated that the mechanical strength of that material at the high porosity and interconnectivity matches that of cortical bone. We then implanted it as is, no biologics, autoclaved and pressed fit into the defect, tibial large bone defect in the sheep. And at 3 months, you can appreciate that the material maintained its mechanical properties. When we looked at 3 months and 1 year, these black areas are the struts of the ceramic. This is new bone growing into the ceramic. You can see bone growing from the edges of the defect. And by 12 months, we had the defect completely bridged with new bone. Some evidence of material degradation when there is enough bone has formed into the material. And this material now has been assigned to Allegra Orthopedic by the university in exchange of equity. And the first application they're going with is cervical interbody spine fusion. And they've received the first FDA approval for the design of this material. We have had healthy funding to take it to the clinic. Most importantly, the mechanical strength of this material compared to the FDA cleared spine device is better or in par with that material. Now remember, the bioactivity is quite high for our material. Ali, who's a postdoc here, employed on a joint grant with Allegra. He's working on making screws of this material. So the whole idea, can we replace the metal with ceramic screws? And he gave me this figure with the torsional strength. You can see that our material is way up there in its mechanical strength. Another material we've developed over some years now, again, they're all calcium silicate-based material. Here we incorporated zirconia into the material. We determined its in vitro bioactivity with osteoblasts, osteoclasts, and endothelial cells, and we validated its in vivo ability to regenerate bone in large bone defects. Can we then turn this ceramic into a brittle material? And this is the work that we did in collaboration with Shanghai Jiao Tong, where Mohammed made this material in a special printed design and implanted in a rapid calvarial defect. What you appreciate here, as more bone is formed into the material, it now turned the material from brittle to tough. And this is the first report on a ceramic turning to a tough material. This is all new work that hasn't been published yet. The challenge, of course, as many of the clinicians would know, the challenge remains is that we cannot print complex geometries of materials using the 3D printing method that I showed you. And this is important for cases like this. And because we hopefully won't rely on biologics, we want to print the material and put it in the defect as the patient come into the clinic. And again, with this is the work of Mohammed, a recruit 2 years ago from McGill University to my lab, and he just got his DECRA fellows starting next year. He was able to produce new stereolithography 3D printing technology that allowed us for the first time to print complex structures of these ceramics. What this means is we can now have the freedom and flexibility to print any shape or size of these materials and manufacture them. We work very closely with Ching Li and mathematical modeling. And here, the jawbone is highly dynamic biomechanical environment. So we're using numerical modeling techniques to optimize the design of plate fixation for mandibular restriction, which can be adapted to anything you want. In collaboration with ETH Zurich and Zurich University and funded by a recent CDIP grant from the University of Sydney, we are now taking this to test it in a sheep model for osteochondral defect. Let me now change gears and go to the tendon and ligament. This is a recent paper on the work with Young No while he was doing his PhD with us. He's now a director of education here at this school. We developed this tendon and ligament material and validated its in vivo ability to regenerate the tendon tissue in the rat, and this was done with Columbia University. The material had advantages. The question I asked David Hunter earlier is because the only thing that we don't have with this material is it does not degrade. We now are writing an ARC linkage in collaboration with Allegra to take it to the next level. Zhu Fu in the lab, he's a biologist, and he asked the question, can these materials that we're developing, the ceramics, provide anti-senescence microenvironment, partly because of the results of the Baghdadite I showed you and how they induced brilliant bone formation, even in a large bone defect under load without any biologics. So again, in collaboration with my good friend, he's a maxillofacial surgeon, Shanghai Jiao Tong, we put this material in the critical size defect in aged rats. So we're trying to test it in an aged animal for 8 weeks. And what you see here, this is the control. If left empty, nothing will generate. The hydroxyapatite tricalcium phosphate is the clinically used material manufactured to the same standard here in the lab and 3D printed. Again, you can see a little bit of bone formation, but much more with our material, the Baghdadite, and this was validated when we measured bone volume to total bone volume and the bone mineral density. Red is our material, significant increase in these parameters compared to the clinically available and the control. Further looking at the histology, fibrous tissue forming in the control compared to little bone in the clinically available material, much higher bone volume in our material, red. So this is the theory by Zufulu is if you implant these materials normally implanted in an elderly patients, they can turn probably aged cells to young cells. The paper just got accepted for publication, so it should appear in the literature soon. The next work is from Dr. Singh, again with my group. He's developing the next generation targeted theranostics multifunctional magnetic nanoparticle, and I would like to share with you the video that the university did on this that explains it. Diagnosing and treating cancer takes a huge toll on patients. We are developing the next generation of intelligent nanoparticles-based nanorobots that will selectively identify and kill cancerous cells. These nanoparticles, optimized with targeting molecules, are injected into the bloodstream. If we know the location of cancerous tumor, we can use a magnetic field to guide the nanoparticles to the cancerous tumor site. Once they're there, the nanoparticles are able to release drug molecules that can kill multi-drug resistant cancer cells. We can also trigger an alternative magnetic field via an MRI scanner that causes these nanoparticles to release heat to the surrounding environment. This kills the cancer cells that allow healthy cells to survive. Our research will allow for easier diagnosis, monitoring, and treatment of cancer. So these are the different multifunctional magnetic nanoparticles that Guru is developing. We can functionalize them with L-DOPA, and L-DOPA can cross the blood-brain barrier for targeted delivery and heat-related therapy. So delivery and therapy. And I will skip this for the time. And I want to come to this very, very hot off the press work of Dr. Peter Newman in developing novel 3D printed technology to print structured organoid. This project, we use 3D printing to generate microstructured organoid systems. These are multicellular structures that reproduce much of the complexity of the organs in ex vivo. This is, here's a picture, a beautiful picture of skin organoid, which was reported in Nature by Lee et al., not from our group, earlier this year. The problem here is that the structure is somehow uncontrolled, quite irreproducible, where each organoid is different to the next.
Hi, Hala. We're sort of running out of time, so if we could wrap up, please.
I'll wrap up and just tell you that for the bone people, Peter was able to print using his new printer, this structure that resembles the human osteon. And we're looking further into, with collaboration with Westmead Hospital, to understand how the structure is formed during developmental process. Thank you. Purian, we can't talk about your work.